think the study was very interesting in that it showed that for the past 2 years, drug pricing has been very stable, but that the brand drug pricing is very much higher than our generic spend, and that the branded drug products and branded specialty products continue to become more expensive. Generic products are the same chemical structure as a brand product, but once the brand has lost its patent, other companies are allowed to manufacture that chemical structure or that medication, and generally will sell it for a lesser cost. We don't really have any federal regulations about drug pricing. The pharmaceutical companies can set the drug pricing at anything that they want, and insurance companies will then try to negotiate a price that they are willing to pay for that drug. A specialty brand drug is a drug that is generally used to treat a more complex or chronic disease, such as maybe Crohn's disease or ulcerative colitis, rheumatoid arthritis, something like that. And these specialty branded drugs often have to be delivered through a specialty pharmacy, and they're often given through an infusion. Nationally, through the Blue Cross Blue Shield Association, there was an 82% generic prescribing rate. Our doctors in Nebraska do an excellent job of generic prescribing, and we have an 85% generic rate. And so even though our drug cost, our branded drug is only 15%, however, it is 80% of our drug spend. Well, I think that consumers need to have really frank discussions with their physicians, because these out-of-pocket expenses for the drugs can sometimes make it impossible for the patients to take that medication. Especially if they're on a high-deductible health plan, sometimes the whole cost of a month's medication or 2 months medication may be the patient's responsibility, and then they may not take that medication. So talking with their physician and trying to take generic drugs when possible is a great way to help us curb healthcare costs.